friends, welcome back to Know Thy Health. Today we're uh, doing something a little bit different, just a interview with my friend here, Daniel, our CEO, the Risk Whisperer. Daniel has, as we've mentioned before, a longstanding background as an actuary in the health insurance space. He's well published and written a lot, mainly for Paragon Institute around both, shaping policy, but also just, information for experts and consumers alike around the topics of health insurance and what impacts it has and what impacts health insurance. And, I think that's all, good and great. And, what he's able to do as an expert. But I think the real value in this is like what it means for the average family and the average consumer. For me, like, I hear no shortage of complaints about health insurance is just so expensive. I don't understand it. It's frustrating. It doesn't pay for anything. And so, you think back to uh, the good old days, maybe even, 10, 20 years before Obamacare, right? And like, when our grandparents and parents talk about health insurance and how cheap it was and that they had a $500, out of pocket max and these great copay plans. And it's just not what it is anymore. And so, I wanted to bring Daniel on and just have a kind of consumer facing and like, individual and family facing conversation with an expert who's, done a lot of research in this space and built a lot of plans, for families like yourself. So, Daniel, our first question is, how in the heck did we get here?
Thanks, Cameron. No, that's a great way to tee it up, man. I think this is a great conversation to have because Americans struggle with they know something's wrong. They know that you'll hear it. Healthcare is broken. Healthcare is expensive, and we just don't have good solutions. And where do we go as a nation? And I think it's important to just have like a nice primer of a conversation where I can share a little bit of the lens holistic, from kind of a global view, and then we can talk about like healthcare down to the family level there. But I think the first thing I find fascinating with the question of, why does healthcare cost too much is starting from the question of, does healthcare cost too much? What does that even mean? Like, what does it mean for something to cost too much? Right. Um, so you hear stuff like we spend $5 trillion on healthcare in the United States, which is like, all right, that's a massive number. We spend way too much. Okay. Percent of our GDP of our total spending, about 18%. That sounds like a big percentage. What do other countries spend? They spend less than that. You kind of get into this like, okay, like does 18% sound too much? What that boils down to ultimately is roughly $14,000 to $15,000 per person in the United States. If you get to like an average household, that might come down to about $3,000 on a per month basis, which is obviously a sizable amount. Most of us don't actually pay that $3,000 directly, but as a nation, we spend about $3,000 on, say, like a 2.5 person household. So one thing I always like to do is just ask the question and get people to think about this question of, of all the things that we spend money on, our allocation of resources really just indicates like what we value more. So some of the fundamental things that we value as humans might be housing, food, transportation, health. Is obviously one of them. Your health is one of the most important things that you can spend money on. And if you look about the average household, you spend $3,000 is spent on households for healthcare, about $2,000 for housing, a little bit somewhere between $2,000 to $2,500. So putting it in context, I mean, it's a little bit more than housing. You should start asking the question like, is it more valuable than a house? For food, we spend about $800 to $1,000 per household. Clothing is like nothing nowadays, and transportation's somewhere around $1,200 for your car payments and gas and all these things. Putting it into that context, I think just as a baseline, I would say most people wouldn't be as shocked if you asked them the question, should you spend roughly 20% of your money on your health? It doesn't strike to me, at least immediately, as like totally outrageous to spend it on your health. Why? And starts to begin the process of why healthcare can cost so much almost in any environment is because there's obviously no replacement of your life. There's no replacement of your loved ones. In economics, we call it an inelastic good. Like the prices, like the question you should ask yourself is, if I had a heart attack or my loved one had a heart attack, what would I pay to save that person's life? Would it be 10,000? Would it be 50,000? Would it be 100,000? Would it be 200,000? Would it be endless, every single dollar that you have? So unlike other goods like a house, which at some point there's a threshold of like, let it burn, I'll throw it away. There is no threshold for how you can value a life-saving um, good or service that you get for a loved one, right? So that's like the initial problem with why healthcare can cost so much to begin with is in that scenario of a heart attack, your wife has a heart attack, she goes to the hospital, they have a life-saving coronary artery bypass surgery that they do. She has multiple stays in the hospital, and that will cost on average like $150,000. Okay, that's expensive, but is that worth it? I think anybody who got their wife life saved would say, yeah, that's worth it. Okay. Um, so that's one thing just to think about. The second thing to think about is almost in a interesting kind of reversal of the question of how much should we pay as a society for healthcare services to attract the most talented people to perform those life-saving um, services? So take like the that same heart surgery. An average cardiologist surgery is $500,000 a year, massively more uh, income than the average American household. And as a society, we may say, "Hey, that's too much money. We don't want, we don't. That's way too much. They don't need that much money." But the reverse of that question is, well, if you don't have a salary that's high, do you ultimately get a less quality type of surgeon that's actually performing these surgeries? Do we actually want that? Do we want to pay cardiologists $100,000 who will ultimately perform those services? It's not going to be your top of the class people. It might be the middle of the road, the people willing to have a high pressure job, go through medical school and not get paid that much. At the end of that, you'll still get some good-hearted people, but you're probably going to lower the talent pool for those performing those surgeries, right? And so there's another question where when we say how do we slash the cost of healthcare? One thing to always caution the American mind is like, you can do that, but that means you're slashing the income for those that are ultimately performing those services or creating the innovations. And so it's not that we shouldn't slash it. It's just that to understand there's a consequence for kind of lowering healthcare costs. And one of those might be some of these high talented people are instead going into like software development or something like that. So that's kind of a second question just to have in the background. Now, when you think about that $150,000 surgery, you can immediately see that society has a problem that they have to fix because none of us, and this is going to start into the question of like, why do we have insurance to begin with, and how did we get here from the insurance lens?
Mhm.
This one example explains it pretty clearly that like none of us, most people don't have $150,000 sitting around, where they can just pay for that service and not be in financial trouble. That's going to cause bankruptcy for most Americans. And so, as a society, just naturally in the private market solution to this is, well, you could band together into this concept called insurance. We can pool our risks together. We all pay. We flatten out that expense because only like 20% of the people are going to have high costs so that we can subsidize it with the other 80% who won't have a high cost, level it out. And now we have kind of a modern way of paying for these very expensive type of services, like say saving someone from a heart attack. So that's the first thing. And that works pretty well. Like you don't really even have to have that many people pool money together for statistically that to work out well. You probably need about 10,000 people. So this is actually something that you can solve on a kind of a low, even like local level, like just in an organic way. But then we always have problems with that arrangement. If you have 10 people, you're going to have a few that are too poor to afford that cost and they can't pay that monthly amount to enter these risk pools to get access to that. You're going to have elderly people that are no longer working and they're not barely even taking care of themselves. They need their family to take care. They can't enter these kind of contracts in private insurance. And then you're going to have the really sick. I'm already sick. I can't get access to an insurance product because the people are going to be like, yeah, if you come here, you're going to explode our costs, right? And so you always have these kind of three problems where for 80% of the people, the private market solution of insurance, and Cameron, you alluded to it, like the pre-Obamacare days when, insurance companies and these risk pools that are organically in the private markets can create rules to keep, you have to be healthy to start off, right? Um, that keeps the cost low. But then as a society, you have these outliers. What do you do with the 20% of the people that can't get access to insurance? The sick, the elderly, and the poor, right? And so as a society, we have slowly over time in the last 50, 60 years, as our healthcare system has modernized, come up with government solutions for these, right? So for the elderly, we came up with Medicare. So let's get them on a federal Medicare program that covers everybody at the age of 65 and above, and you pay taxes all your life to go into that. Okay, you solve that little bucket. Then you get Medicaid. If you're low income, the state government, the federal government, we kind of split the cost. Let's get the low income people onto essentially free coverage at the state level. We've taken care of the poor people. And then the sick people, we came up with this concept of guaranteed issue. Insurance companies can't cover pre-existing conditions or can't exclude pre-existing conditions on the Obamacare marketplaces. Now these people can have access to this coverage, and the federal government throws a bunch of subsidies at that market to kind of cover that cost and make sure that risk pool is big enough to kind of take care of that, right? And so we have created a system that has tried to solve the problem of what do we do with those 20% of people that can't get access to organic private market health insurance on their own, which is a good thought. The question is, like, was it the right solution in all of these cases, right? But that, and I think what Americans have yet to fully realize is what that has done. It has split how Americans interact with the healthcare system into like three very different buckets. So I'm going to go back to the question. The original question is, healthcare costs too much? The answer is actually we don't know, because 40% of Americans today, again, trying to solve this problem of how do we take care of the people who can't get access to insurance, we've in a sense overcorrected, and 40% of Americans have direct federal or government-based insurance. 40%. 95% of Americans have highly, highly subsidized health insurance. So most of us get our insurance from our employer, who pays over 80% of the premium on average, that covers most of the cost.
For the employee.
So for the employee, yeah,
Yeah, sure.
which is, yeah, for the
Some
employee.
some families listen to this like they don't cover 80% of my family coverage, but yes, for the employee's coverage, they have to cover 80%.
For the premium.
Yes, for the premium.
Right. And so you still have cost sharing and all these things, right?
100%.
Like, so I would say that, there's a couple things to understand, is that, and this is back to like your free market economic reality, which is the government programs. Again, 40% of Americans are price controlled programs at the federal level, meaning, this is like, if, I think a lot of like conservatives are against, socialist principles, against communism, against all this stuff. One of the biggest problems of socialism, of communism, is a centrally planned economy that controls prices. So we have that in the United States. It's called Medicare. Medicare literally controls the price of healthcare by defining how much a service costs and forces that into the marketplace. Meaning a hospital or a physician is told how much they're going to get paid for a service by the federal government. And that's, 20% of our population is on that. And it's 20% of our sick population on that, our elderly, sickest people, right? At the same time, Medicaid does something very similar. It's very similar, but it's kind of happens at the state level. They do the same type of price controlled situation. So what has happened is hospitals and physicians, because of this distortion in the marketplace, they lose money on every government person. So they lose money on 40% of the Americans out there. So what they have to do is overcharge the private market, overcharge anybody who's not part of this price controlled environment. So your employer based coverage, your Obamacare, and this is known in the industry as like what percent of Medicare does your program pay? So typically, if your employer is trying to get access to insurance, they're paying 200% of Medicare. They're paying 2 times the rates of Medicare rates. Why? Because the hospitals are having to react to this price distortion that exists by a centrally planned, federal government. So the first question, does it cost too much? It depends. If you're on Medicare or Medicaid, you have the federal government that has literally forced hospitals and providers to take a loss on your services, meaning you pay too little. Like like even the amount that you've been taxed all of your life, I remember seeing an actuarial report, is half the amount that should be in order to adequately cover Medicare costs, which is why Medicare, we have a problem at the federal level. It's ballooning the cost, right? So on one hand, like you've paid too little. On the other hand, if you're in the private market and you don't have government insurance, you pay too much. You're subsidizing the federal government enrollees, right? And so I think that's what most people, when they say healthcare costs too much, most people are feeling that sticker shock of a healthcare system that's trying to balance out this market distortion of what happens when a federal government price controls. Um, that's the first thing. The second thing is we also don't know what healthcare should cost because we don't have a free market where the people receiving the care actually bear the brunt of the cost and have the choices to decide between A or B, right? So, like in a free market, you have to have the people actually receiving the service know the cost, shop, and make decisions, and organically you develop prices. Well, 20% of all healthcare spending falls in this elective um, payment area where you are electively deciding to pay for healthcare on some level, whether it's electively deciding for premiums or your cost sharing or whatever. 20%. 80% is non-elective. It's passive. You don't even know. Your employer's paying for you. The government's taxing your employer. The government's taxing you. When you're on Medicare, you're not even paying, you're paying just like a little portion of the overall cost. In Medicaid, you have zero cost sharing. So when you have a situation where 80% of the healthcare costs are non-elective and passive, you don't have a free market. So we don't even know what healthcare should cost. It's kind of like if you're a teenager and you're like, your dad basically funds, you paying like for Nikes or whatever, and like gives you like, here you go, here's like $200 to go buy some Nikes. You don't really feel and understand the cost of it until like you would actually have to like get your own job as a teenager and pay for your own Nikes. Then maybe you're buying Starberries from back in the day or whatever, like when it's your money, right? Like, so we're kind of, I think there's part of it is like a sticker shock. And I always use my dad as an example. Like I use my dad as an example. I remember he had Kaiser Permanente out here in California, and he was like telling me like what he pays. Like he paid a good portion for our family insurance. And he's like, Daniel, I pay $1,000 in premium, you know? And I'm like, yeah, but you think that's a lot of money? You're only paying a portion of that premium. Like if you were paying the full premium, so part of it too is like we're held back from the cost of healthcare. So anytime we interact with the actual cost, it feels massive. Whereas we should think of it as like, okay, it's 20% of my family budget. That would change the way if you treated it like a mortgage, you would start to think about it a little bit differently. But because we're shielded, partly is the problem. So anyway, does that if it makes sense to you, Cameron, then we're probably on a good level. But like market distortion, shielded from prices, I think is kind of the first thing to understand.
Yeah, I think I think you set a good precedence on like kind of the meta narrative from a regulatory and, just a historical level of how the government has been involved in this. And then I think behind the scenes, like when you peel back the layers, there are there are some topics that that bounce around in the consumer space. So, like for example, one of the books that was popular several years ago, I think a lot of people in this space, like in the healthcare or in the health insurance space, read this book first. But I've known several people, several consumers, just general population folks who don't operate in this space have read The Price We Pay, which is The Price We Pay, What Broke American Healthcare and How to Fix It by Dr. Marty McCary. He's a John Hopkins surgeon. Like you kind of get to the end of the book and like you feel like you need to take a bath. You just like you're like, yeah, this is disgusting and gross. And really, like the findings there are that all the investigative like research and that his team did was that there's this whole practice of just opaque pricing and overbilling at the hospital level, at the facility level, the provider level, and then even you know furthermore, there's over treatment, because providers want to get paid on unnecessary screenings, you know, just kind of misaligned profit motives, so on and so forth. And then the other argument, which I don't think it's a big number, but there's the kind of middleman profiteering, which this is what you hear with like the Mark Cubans of the world on the PBM side, right? So you got PBMs, you've got insurance brokers, you've got these like group purchasing organizations, right? And so you get all these hidden fees and these kickbacks. Some of that's more relevant in the group insurance or the employer insurance world than like the individual, but it does happen there. And so, there's really this whole drive or this idea. I think that consumers, and with some of the recent legislation, right, that consumers have started to like, we want more transparent pricing. And some states have tried to enact rules around this, and the hospital systems have found loopholes to get away from it, right? So I guess as like an actuary and someone that's been on that side of it, like, do you see those three things? The middleman profiteering, overtreatment, and overbilling. Do you see those types of things as having an impact on why it costs so much, or is it nominal compared to some of the just the regulatory nature of where we're at?
Yeah, I go back to it's actuarial, but it's also economics. Like I go back to, there's a difference between what's wrong on a first principles basis and then like the secondary causes because of that initial problem, right? And so what all the things that you're describing, I would categorize as, there's people that can abuse the system that currently is in place for XYZ, but it doesn't speak to whether or not the system itself is the right system or what's kind of the fundamental problem, right? So if you take like the fundamental problem is what drives costs and efficiency in a normal free market is competition, right? And so like let's take the middleman problem for a second. So you say, oh, the middleman or like the insurance company is taking out of the system, a bunch of dollars, whatever it is, like 10% of the cost, like name a number. Um, well, in a competitive marketplace, it doesn't really matter if they're abusing that or not. Like if they're taking out 10% of the cost, then they're adding 10% of the cost and they're not price competitive and they lose enrollment. And so they have to stop doing that and they have to go back to their competitors, right? And so like we often as Americans, we just forget like basic principles of economics and we just we'll start complaining about certain things without saying like, wait a second, why is it that insurance companies or why is it that these middlemen can get away with stuff like that? Well, I'll name one huge problem. Let's just take employer-based coverage. Half of Americans get their insurance through employer-based coverage, and your employer covers, 80% or more of the premium, and you only have usually like a $1,000 to $2,000 deductible for employer plans. So you actually aren't exposed to the cost. So what does that mean? It means that health insurance companies or middlemen are not marketing to the employee, they're marketing to the employer. If they were marketing to the employee, they would want to make sure that they're going to be competing on cost, on value, on the quality that you're receiving. If they're marketing to the employer, you got to ask the question, what does the employer want from their healthcare? Well, they just want to attract employees, right? Like you want to attract the best talent. You want to control your cost, yes, but ultimately you have a healthcare benefit plan to make sure that your employers get access. So that's why, what do they usually have? They have big PPO plans. They get the biggest name in the market, right? Because if you go to a new employer, the first thing your wife is asking is like, is our doctor in network? Who's covering it? And you as the employee says to your wife, oh, it's Blue Cross Blue Shield. They got a PPO network. And your wife says, cool, let's take this job. I think we should take this job. Let's take it, right? And so you, that's just one thing to understand, that like there, when an employer is picking the plan, they have different motivations for cost. They have a cost and efficiency. And so you might have like a United or something that can take out extra costs, and maybe they cost more, but it's okay because the employer is willing to take it as a, as a tax deducted expense to attract employees, right? So again, secondary cause of a first principle problem. First principle problem is that the families are not actually the purchasers of healthcare. That's fundamentally the problem. Now, the second thing, let's go to price transparency. Everything is opaque. Everything is out of, this is true. But what is the first principle cause of that? The first principle cause of that is, number one, what we just talked about. People aren't they're not actually competing to like get you to purchase that service. If it's a $30,000 service and you have a $1,000 deductible, who cares whether it's 25,000, 20,000, 30,000? And your employer pays the premium. Who cares, right? They're not actually having to go after you. The second thing is, again, these hospitals are being forced to take the Medicare rates. So for surgery A, Medicare is saying we're going to pay you 10,000. For the hospital, it's actually going to cost them 20,000. So to make up for that, they have to charge 30,000. And so there's this confusion of like, what does this actually cost? Nobody really knows. The hospital is just like, well, I have to make like a nominal profit margin. And I remember I did this study in California. I pulled all the hospital data, and they were making about a 1% operational margin overall statewide if you just like aggregated it. So they are literally just trying to balance that out. So again, are there people that can take advantage of this? Yes. But why are they taking advantage of it? Because we don't have a free market competition system. And number two, 40% of Americans are on a price controlled government plan, which is socialism. And let's just talk about number two for a sec. And this is we're at like the last stage in our economy on the healthcare side of pushing back against what every other country has done outside the United States, which is a single payer, socialist, federally controlled government program. And it's un-American, right? We're at that last stage, and we have a major problem for those that believe in free markets, which is they want to talk about stuff that you talked about: price transparency, cash pay. They want to come up with solutions that are secondary causes, not first principle problems, right? Okay. This is a big problem because when you have 65 million people on Medicare, that drives a ton of the costs in our healthcare system. And most of those are Republicans. And most of those have free coverage, or not free coverage, but highly, highly subsidized coverage through the federal government, through a socialized program. The only, you know, the only free market side in the political aisle would have to abandon one of their key demographics to do anything about this problem of a socialized, federally run, price controlled market that's making all of these distortions in the first place. So nobody has had the courage, I would argue, on the Republican side to say, how do we fix Medicare to make it actually free market and start to eliminate some of these price distortions? There's nobody that has the courage to do it. So if someone had the courage to do it, I think there are creative ways that you can start to do it. And this actually goes to your your background, Cameron. Um, I don't even know if we've had this full conversation about ICRAs, but it's one of the reasons why, like, take my Presidio hat off, take my everything hat off, and just put my American father hat on, the country that I want my kids to grow up in. There is a revolution to flip the largest market in health insurance, which is the employer market, and to start to attack some of these competition issues, which is the market that you were heavily involved in, which is the ICRA market. Um, so like if for those who are not familiar with this, I really think that this is something that can begin to be the groundswell to kind of change some of this, which is, think about your retirement plan. It used to be pensions, right? You talked about like people talking about the good old days. The good old days used to be pensions, right? It flipped from pensions to 401ks, meaning defined benefit to defined contribution. In healthcare, we are in that defined benefit situation where the employer is deciding for every one of their employees what health insurance should look like. It's called defined benefit. There's a movement to switch to defined contribution where instead your employer says, how about we just give you the money and you, as the family, go out and purchase insurance that aligns with your values. You can think about the cost, right? This is a radical shift for what is 150, 160 million Americans. And like, I think people have attacked it because it's in its infancy and all these problems with it, but they need to like step out for a second and think about this holistically, that like what you're doing is you're starting the process to train Americans to actually interact with healthcare costs. So instead of only 20% of the cost being elective, let's start to make it 100%. How do we shift half the country to make 100% of the healthcare stuff elective? Now you have a difference. Now you have a just starting from the insurance side and from the physician side. Now you have both the payers and the middlemen having to think about what is the value prop for every single family in America, as opposed to employers. And families, talk about, price elasticity. Families are much more price sensitive than employers. And so that's going to drive competition. Yeah, I don't know if you have any thoughts on your history with the ICRA
A lot of
community.
thoughts. I mean, generally, like we need to see some, legislative changes, both at federal and state level, to allow for right more competition in the ICRA market. We need more access, more alternative products to be able to uh, drive, the cost sharing down, to drive, um, the premiums down. Like there needs to be, more options for consumers that are more affordable. The I always say like the product parity is not there that you had in the pension to 401k shift. Like if your employer is investing in your pension fund and it's in a Vanguard stock, you can take those same dollars and put them in the same Vanguard stock. You can't do that in most markets. There are some exceptions, but you can't do that in most markets from your fully insured, or even self-funded group plan to go find that same, right? Because the employer has designed a group plan with $1,000 deductible, which doesn't typically exist in the individual market that's eligible for ICRA. Uh, and if it does, it's very, very expensive. And so, there are some zero, like low deductible plans, but they're very, very expensive and they're just not affordable for most Americans. But I digress there. And I think it's interesting because you were you're talking about the employer. I mean, in the employer market, in your large group space that can afford to be self-funded, or a self-insured employer who's paying most of the claims, if not all of them, up until a certain point, except for the high dollar claims. They partner with like a reinsurance carrier. Those employers are incentivized to these secondary issues, the opaque pricing, overbilling, um, helping their employees be good consumers of healthcare. The employer is kind of incentivized to help their employees do that. So as we see a shift to, ICRA, or the employers moving to the individual markets, I think it puts some of that onus on the carrier to empower and kind of equip their members to be good consumers of healthcare, right? And we could do a whole nother show on, you know, the racketeering that goes on within a health insurance company to like, control their own profits and have separate profit centers within the and drive their members to certain facilities that, drive more revenue. But that's a whole nother episode. So, not to get into that, but like, yeah, it's certainly we're in like we're still in the infancy stage. It seems like we should be, and I think most folks in the ICRA space expected the shift to happen a lot more rapidly than it has. It's still happening pretty quick. Um, but I think they thought it to be like as immediate as the pension to 401k shift happened. It's going to take a little bit longer because it's going to require that free market competition. But yeah, to your point, um, I think we're well on the way to seeing that. It would be, we were talking about Medicare. It would be interesting. I was just listening to a concept around like the Social Security stuff and what they're doing with Doge, right? But and what their findings are and the poor management of like the Social Security fund not being invested in like, you know, the right assets to be able to like grow that fund over time. Like, it would be interesting if you could, garnish or withhold someone's wages for Medicare spend, but then return those dollars back to them at retirement age, to allow them to be able to choose competitive products versus just being it would be subsidized but completely funded by the government. Like there could be some plays there that policymakers could think about. But yeah, I mean,
No, just stop. Well, I mean, stop on that for a moment. Like, yes, like
like
why? Because what would you have to? You would have to actually. Yeah, I mean, I think it's the difference between controlling versus empowering Americans to interact with the healthcare system, right? So, like, the Medicare system is we take your taxes, we take your money, and then we negotiate. We choose how to negotiate with hospitals, and we choose what benefits we cover, and then you just get the program when you're 65. Okay, like you're basically and it makes sense. Like if your employer pays your insurance from the age 18 to 65, it makes total sense for an American to be like, yeah, like the government then should take over at 65, right? But if you flip that and said like, no, 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 the government tries to allocate resources and kind of redistribute a little bit, but give you the money to go purchase your insurance, you would be an active consumer. But what I think there's like a step here, like to get there, if the employer market was like that first, then you would have people that are used to buying their own insurance their entire life. If you bought your insurance your entire life, you would be like, this is kind of stupid that I can't buy my insurance now that I'm 65. Right. So, like, I think that what you just said is exactly.
yeah, let's take your tax deducted Medicare dollars, invest them in a currently productive asset, S&P 500, for example, that returns 9 to 10% a year over a long period of time, and then somehow those dollars get redistributed to you for the purchase of, maybe it's a socialistic. Maybe I got to think about this. Maybe that's like a socialistic, uh, you know, economic play. Like there's some socialistic economics there, but those dollars are returned to you to purchase, you know, Medicare options, which may have some cost sharing subsidization like we have in the Obamacare market under 65, um, to subsidize the cost to the carrier. But you can choose a very like low premium because you're 65, you owned a business your entire life, you've got a few $1 million in the bank. You're like, if something happens, like I'm 65, I probably got like three three bad rainy days left. I mean, I don't mean to say that. I don't. I want to be sensitive, but like, if something happens, I can afford the $10,000 out of pocket max. My grandma gets sick, like she just calls the ambulance and goes. And it's covered. She doesn't pay anything. Except for her separate parts of the part C's and whatnot, or her Medicare Advantage. But other than that, like you just jump on the ambulance and you go and it's paid for. And there could be an opportunity there to kind of reinvent, um and, and maybe that's in some ways Medicare Advantage was meant to be, but that's a whole nother conversation. So that would
No,
be
because
like an
Medicare, yeah, no,
interesting
no,
play.
because Medicare Advantage is capped, right? Like
Right.
the government gives the carrier X amount of dollars. It's a different form of price control. It's the same thing, and then it's like who can manage the care better, but it's still under, like if Medicare had to pay actual cost in today's market, the entire program would cost 60% more. They'd have to jack up the rates 60%, right? So Medicare Advantage still has the cap. No, but what you said so I think, and what I wanted this conversation, like what I hope people get away from this is like there's two things happening. There's kind of the distortions and lack of free market that is our today's reality. And within
Mhm.
that, there's all sorts of like ways that you could maximize your savings, right? I call these health hacks. These are health hacks that you can find ways to like, and there's people out there trying to help you find savings, right? And that's all great, right? But when we talk about American healthcare solutions, it has to tackle the 40% of Americans that are on price controlled care and the fact that 95% of Americans have subsidized coverage, very people, right? These are the two principles. So I think what you said is something that I think is so important for like the healthcare policy world to think about, which is, it took 50 years for us to get to this point, and they're still trying to get that. They're trying to get into the end zone with a single payer system. It's taken a long time to kind of like break down the American healthcare system to make it centralized. It's going to take like 50 years if you want to reverse that. And so we can't let purity be like a roadblock for those that want free market solutions. Like you said, like, oh, it's still a little bit socialist. That's right. Like we should think of ways that aren't perfect, but like start to move the needle. And I think what's even more important is like training Americans to want to engage in the healthcare system, even if it doesn't produce cost
Yeah.
savings initially. Because
Well, you got to
the goal of,
fix the overcorrectness, right?
yeah.
Like we
So like you
overcorrected with like too much socialistic funding of Medicare, right? Or Medicaid's a different thing, but Medicare, for example. And so how do we start retraining to like fix that overcorrectness and bring it back? You can't do it like in your purity statement, right? Like you can't do it in one foul swoop. It's going to take a lot of time to bring it back. So um, yeah, there's probably no shortage of like ways that this can be done. Um, but are we? I'm hopeful that some of the things that they're doing, our commerce secretary is doing, and they're doing on uh, you know, the things that impact like GDP. They're thinking about things in this way, and they're starting to think about things in this way as it relates to Social Security. I think Medicare is another, uh,
it's
is hopefully the next step. I don't know. I don't want to like. I'm not going to hold my breath, but yeah,
well,
you're.
it's political dynamite. That's why I think that's one of the biggest challenges. So it's so much easier. It's why the conservatives love cash pay stuff. They love price transparency because it's a home run. Who doesn't want price transparency? Who doesn't want like it's so easy, but does nothing to fix our healthcare system. So it's
Mhm.
just like let me just hit this little easy grounder, and I'm cool, right? And so I think we're gonna have to see a couple of courageous people start to bang the drum on this issue. I would, but it's got to happen pretty quick. It's going to take a long time. But anyway, this is so. I think we could probably like. I think we've gone through the conversation. We can probably circle back on different points of this later on. But
Yeah, for
I just
sure.
wanted. I mean, my goal here is to like add some nuance for folks to like not just regurgitate like, oh, healthcare's broken, healthcare's too expensive, and like, because you can get trapped by people that they'll use that and come up with something that sounds nice but is not a real fix for the American public, right? And then also like understanding that the reasons why we've gone too far, it's still addressing a real problem of what do you do with the poor, the sick, and the elderly. And
Mhm.
it's, we're not going to just deny them coverage if you can't pay. So this is a unique industry that's going to have some type of quasi free market, quasi government involvement. Like the libertarian idea is of just like, let's just let, it's not a workable solution, or at least like you can't even conceive it unless you like start down this path. Right. So hopefully that was helpful. I mean, hopefully this was a helpful discussion for you guys just to get the wheels churning.
Yeah, there's a lot of opportunity with the new administration and where we're at a point in time as it relates to healthcare and health insurance, which is our focus and our piece of that pie. But there's we have very green pastures, I think, that we could go out and really start making some change. And yeah, we call on, as much as we would love to use these things like overbilling and overtreatment and you know insurance brokers that are racketeering with commissions, like those, like Daniel said, are all secondary things. But as much as we want to say, like, well, you know what, go be a great consumer of healthcare, uh you know upstream of that is some really bad and overcorrected legislation that does not really allow for the right free market competition. And so, what does this look like in 20 years? I hope that it's a really, really strong free market at both the under 65 level and the over 65 level, with or with components, you know, that are going to look different in each of those markets because of the healthcare risk, but components of a Obamacare style backed, funding by the government to take care of the vulnerable. So we'll see what that looks like in 20 years, 30 years, 40 years, 50 years, however long it takes our good old politicians to make some changes. But we're generally optimistic at Presidio, and so appreciate you guys joining us. And if you guys have any questions or any thoughts, or maybe you didn't like something that we said, or you want some clarification, please put it in the comments. We will see you guys on the next show.